Hi, everyone. I think we have a lot of information to put in and digest tonight, but we have a great opportunity here to have all the experts from our Asian countries to share with us the topic on breast cancer screening. So it's now open for discussion. Any questions from the floor? Any comments?
Maybe I can ask a question for the two speaker from Singapore and Taiwan. Maybe I'll start with Dr. Tan. What would you recommend Hong Kong in terms of, given your experience in Singapore, in terms of screening? What are the two messages that you would like to give to us?
Firstly, can I understand that the screening program now is only for the high-risk women, yep, and as defined as those with genetic mutation or family history?
Yep. Okay,
so then the first message should be that you might want to reconsider your definition of high risk. Okay, because I think all women are high risk.
So more like a universal screening program that you're thinking of. Thank you. What about Professor Chen?
Yeah, I think right now, I think although we heard about risk-based from Hong Kong, the two presentations from Hong Kong, one is case control study to identify risk factors, and the other one is from Polygen. It's a very good presentation to combine the Bayesian models. And I can understand, you know, for these models, I would suggest we can still think about the risk base. But the problem is, if you want to go to the population-based models, people sometimes misunderstand one thing is, when we say the risk base, we only focus on risk base. But I heard from your approach, it's a precision strategies. It means, you know, of course, the high-risk group, extremely high, is our target. As you show the genetical inheritance. But the problem is for the low-risk group. Yes. You never know. But when you invite the women don't have the information about this. So how can we apply these respects to whole population base? So my suggestion is, although Hong Kong has not been in operation for organized screening, but this is a good sense because right now we think about if you can use the precisions for low risk group, you consider about not very high cost alternative emergent technical or molecular subtype models. For high risk group, you can still focus on your approach right now. I personally believe that would increase the screening rate, not only that, but also reduce cost. According to my estimations, they can reduce half of the cost. So I think this is the right way. But the problem is how can we reduce the cost for getting the information about the polygen, about this. This is another thing we can discuss.
And hopefully the technology will be cheaper in the future when there are more of them. What about Dr. Cho? Can you share your the current screening program in Macau? Yes.
Thank you, Dr. Wang. And first of all, thank you for Breast Cancer Screening Foundation to invite us, Macau expert, come to here to sharing our experience and learn more from so many experience from Singapore, Taiwan, and Hong Kong. And about in Macau, we also have some pilot study just finished in the March this year. And because before, in the past, maybe we're using some mammography for screening for the women in Macau residents, and only according to the age, allied the resident method. But we find that not so perfect from Asia women, particularly they have the desal breast That is some problem different from Asia and Western women. So we cooperated, Macau Bureau collaborated with University of Macau 2 years before, from October to 2023, and lasting about 17 months. Until this year, March, we had a pilot study for breast cancer screening program, and we invited more than 25,000 women come to our health center for screening for the breast cancer. And we cooperated with the University of Macau and also doing a model for the Macau residents. We totally with 31 questionnaire, and those is some multi-factor, which like Professor just mentioned, the model from other country or resident. And finally, we found, according to the model, finally we found more than 2,700 cases that is, according to the questionnaire, and identified that is the high-risk women. And those high-risk women, we will have further radiology line mammography or ultrasound to further assessment for them. And then finally, we found 37 cases is severe, that including 28 breast cancer and also 9 precancerous breast lesion. Importantly, there are 83% of those cases is finding cancer in the early stage or the precancerous, so they will have more treatable. And we compare with other model like United States Greek model or Indonesia that found the sensitivity and the specificity is higher than them. From the data assessment from the University of Macau, higher than 85%. 85%. So now, nowadays we're using some apps for all the Macau residents. They can using our apps which called Yaotong, and they can have a booking for assessment OPD, and for the first step initial using the questionnaire to assessment first, and then with the high-risk places, high-risk cases, we arrange to have another OPT for arranging to do radiology to further assessment now. So our program is ongoing. That is the phase 1. And then in the future, we'll have the stage 2, and we are thinking more about the AI for screening, help the radiology in the future. Thank you.
Seems very nice development, isn't it?
A question I want to ask the speakers is about accessibility to screening. It's a bit difficult to get women to get out of the inertia to go for screening. In Hong Kong, we are asked, the women are asked to see their own general practitioners and decide on their risk category before they can go for screening. So there's a lot of barriers for asking them to go. So I know in the UK, the GPs will send out invitations to all women eligible just by age to go for screening. So how could it be performed in Hong Kong, as you've heard about our situation here? May I ask our specialists from Taiwan and from Singapore?
This is a very important question and also a very difficult question. Taiwan actually, from beginning, before the nationwide screening programs, actually I have conducted the community-based integrated screening, like the Singapore, to combine the chronic disease and so other cancers to increase accessibility, because then you can have so many different kind of organization institute to combine. This is one approach. The second one is in community public health nurse. I just chatted with a public health nurse to make a phone call for 3 times, and also sent the mail. But I found the mail in Taiwan is always very low response, about 5% only. So this is our, the experience. But after the nationwide screening program, because the government has a strong advertisement and also advocating program to strongly encourage the hospital, the community. Every time when you pay, they give you the pamphlet to ask the client to say, next day you have come to screening. So they try to every means to increase this accessibility. And of course, the final one still not very good for the remote area because as Singapore also talk about very good health literacy about screening. So we try to use a mobile to increase accessibility for remote area. So I think both of means, the invitations is very heterogeneous. It's dependent on culture, dependent on target population, age group, you are talking about. So I believe we still have a plan to increase this accessibility, but it's very heterogeneous for different countries.
Professor Tan?
In Singapore, like I said, the screening centers are in the polyclinics. These are government-run primary healthcare facilities, and because they are government-run, they are highly subsidized, and they attract the population there to go for their chronic diseases reviews and any primary health issues. So when the screening center first started, there was an aggressive push that anyone who walked into the polyclinic, a member of the staff would inform them, right, there's this screening program going on, and if they would like to sign up for it. The other way is we engage our primary health physicians in the private sector, the general practitioners. So we incentivize them that if they go through some of the health screening questions with regards and encourage the patient to go for screening, like for diabetes, hyperlipidemia, colorectal and breast screening, then there's a bit of subvention from the government to the primary care physicians, right? So other than that, I think awareness and knowledge to the women and the population is important. That's why I set out to find out if there were any misconception, myths, misforgivings about it, and this is the area that we need to target, because screening needs the women to come to you, you see, when they are asymptomatic. So that is the challenge, to get that message across.
A question to Dr. Yolanda Chen and Professor Shirley Jie. After hearing all the 2 decades of experience from Singapore and also from Taiwan, what is your view towards how we can promote breast screening in Hong Kong? Yolanda first.
I'm not clinician, but as point of view in public health, I think because given the keeping increasing trend of breast cancer in Hong Kong, so I think awareness, let more women, particularly for the age, for the above 45 years old, 44 years old, the women, so let them know the early detection, which is very important. If they have, personally, if they have resources, and then with some certain risk factors, so even if we do not have a perfect model or risk factor in the tool, but we still try their best, their resources to have at least like a self-examination, self screen, and then if feel something is clinically, and then seek a medical doctor as soon as possible. So I think this is the way. Otherwise, the risk model actually currently is not that accurate. So maybe still certain number of false positive, false negative, but tell them, perhaps positive, but which deserve to try. Yeah. So because if the woman got a disease which is very terrible, which is actually the disaster in the family, Okay, when we look at the overall community, which only contributes to the percentage, but to the family, which is 100%. So, yes, so my suggestion is not expert from expert, but I think increase their awareness and try best use of their resources to protect themselves. Yeah, thank you.
Perhaps I can supplement a little bit from the Hong Kong Breast Cancer Foundation Breast Health Center experience as a service provider of the Phase 2 study, Phase 2 pilot program. In fact, up to October, 4 months after the program started, the Breast Cancer Foundation Breast Health Center has received almost 7,000 inquiries. But in fact, after screening by the nurses, only less than 600 of them are eligible based on the criteria set for high-risk women. So the awareness is here. I think there's 7,000 women called in or booked through our website. Yet, so accessibility is a problem, knowledge is a problem, not only to the general public, but also our very important part of our healthcare system is the primary healthcare providers. Do they have the knowledge of what appropriate would be a screening program should be? And as in Singapore, Professor Tang has said, they have set screening services available through polyclinics because they are where people get there very often for whatever health reasons, however trivial, they get an opportunity to urge them to go for screening, to educate them. I think that is very important for us.
Question from the floor?
I'm
Dr.
Dr. Hui.
Hui.
I'm a medical oncologist from Macau. I'm part of an NGO in Macau promoting the health of women for more than 10 years. So we have conducted a population-wide questionnaire, general population, high risk, exactly the same population that should go to mammogram. We have found a large knowledge gap. And from that, how an NGO in your expert area in Singapore, Taiwan, how can we use the power of the NGO to better promote the mammography screening? Thank you.
Okay, this is a question I just want to add. I forget to tell about how to increase accessibility. Of course, the NGO is a very major contribution. Again, awareness, you know, all you mentioned about awareness. We did a lot of effort to enhance awareness from our NGO by creating the breast cancer club, patient club, very important, and try to persuade from family, from society, doing your questionnaire assessment. So I think the NGO is one of the very important means. American Cancer Societies is strongly promote to build up the world class, the global, you know, the NGO try to reach the goal of the SDG for bringing equality for breast cancer care. I think NGO is is a major contribution. But I'd like to share a little bit about Shelley's models. A very important one, since we don't forget, when NGO or our expert use a risk prediction model, I think actually Shelley did a very good job about the whole overview about the prediction model from the Caucasian population. This I have done 20 years ago. I know the answers. But one of the things I would suggest think about, because I learned from Polly Zhang, you know, they are radiologists. It's very important information. Breast densities is very important. So because our Asian country, the breast structures completely different from the Caucasian population. So that's why when patient with the NGO, they always talk about pain, the fear of pain, like Professor Tang say, the pain, no time, and you know, no awareness. It's because they have a misconception about how mammography convey the message. So today, mammography morphologies become another genotype. So put the genotype, probably your PRS, even the both Dacia models can increase the performance. So I don't know, but you know, I think this is what I tried to persuade. And also, the polygene, very complicated, with a major gene, cannot be detected by conventional statistical models. So that's why the machine learning seeing the interaction with the environment, with the gene indication, and this increase the knowledge gap even for young generation. And young generation affect the old generation. And this is we call the AI, the mergent technicals to impact finally awareness and also screening rate. So I still suggest that we have to think about what is the perspective to increase all populations to participate in the screening. No breast cancer screening, no good family.
Dr. Carol Kwok?
Thanks for the excellent sharing of all the experts. So one question in mind, or one of my concerns, is that we all aware that the increase the rate of breast cancer screening is very important. But I'm more concerned about the subsequent investigation, because it will be a huge financial as well as the anxiety, maybe issues to the women who undergo screening. And also we have to have a very well-planned or also very accurate calculation as regard to the subsequent cost on further investigation. For example, fine needle aspiration, etc., how frequent, what is the interval of subsequent follow-up, etc., etc. Otherwise, I think this would be a very huge burden to the family as well to the woman and also the society. I'm sure that this is one of the concerns of the government, that we would be the obstacle or maybe the barrier of pushing forward the general health screening in our society. Thank you.
In Singapore, if the patient or if the woman is in the program, in the screening program, and she's recalled for further assessment and subsequently requiring further investigations like a biopsy, they're all considered as subsidized rates. Okay, so Singapore healthcare is not free, but when it's subsidized, means that the government will subsidize a large part of it. The patient will still have to pay some part of it, and that's why the MediSave, which is the enforced savings. So anyone who is working in Singapore, who is a citizen or a PR, part of the salary or the salary contribution from the employer as well as the employee goes into this thing called CPF, and part of it is MediSave. So, and we can use the MediSave for some of these investigations to be done. So you're quite right to say that, in this journey of crafting the screening program, it's not just the screening part of it, but the downstream management of the patient, and for that matter, the whole family, right, as well. So there's a lot involved in it. And addressing the NGO question about how NGO can help is that by promoting awareness and knowledge. So for us, other than our NGOs, I mean, we also try to improve knowledge awareness by giving talks to the schools, by giving talks to various companies, because large companies, they have this thing called that they have a responsibility for the health of the employees. So sometimes we get requests through Breast Cancer Foundation and Cancer Society, to give talks, or we run programs for them. We teach them how to do breast self-examination and things like that. And for the NGOs, I mean, if there's an event, and if you can, just set up a booth, right? Christmas is around the corner, Chinese New Year is around the corner. Just set up a booth there, just to promote awareness about it. But I have a question back to you all, because if we are talking about awareness and knowledge, and it does work, it seems to, because you have 7,000 over women calling up, but then your criteria for screening is kind of strict, and only less than 10% meet the criteria. Are we then sending out a wrong message to those who do not meet the criteria to say that you are not at risk?
Maybe Yolanda. And then we probably need to close the panel.
Well, even before these pilot programs, we have been advocating screening like 20 years ago, because this is the 20 years anniversary of Breast Cancer Foundation. They are all voluntary basis. They have to pay for that. So this is a step from the government, but we know the shortcomings of it. So we are among our breast health center and among our steering committee, we are actually finding ways to convey a message to those who call in yet not eligible to the subsidized program. But for all kinds of education, we are advocating that women to a certain age need to be screened. So we are trying very best in the past decades to convey this message to the general public.
And I believe that it's the reform on primary care. So the family doctors and the district health center will also play a role in informing women about the risks and also the procedures and the screening, and also empowering them to do more for themselves, knowing the risk. So now it's 12:51. So I believe, thank you very much for the wonderful panels, for giving a lot of important information for Hong Kong and also in the region. And I want to thank all the audience for asking very important questions, and all the my co-chair, of course. So thank you very much again. And so we will now come to a close for this panel. Thank you.
Thank you for everyone for sharing your expertise with us. Please kindly take your seats. This morning's lecture has come to the end. It is our pleasure to welcome Dr. Yvonne Zhang to deliver the closing remarks.